Good morning and welcome to the second day of the 2019 North Carolina Rural Assembly. Please welcome to the stage North Carolina Rural Center President Patrick Woodie.
Good morning, everybody. Y'all having a good time, I can tell. You had a good time last night. Some of you had a good time way until last night. And that's great. That's what it's all about. So as I told some of you and some of the staff, we're in the short rows now. So we're feeling real good about starting off on this Friday morning. Good morning. Welcome back to day 2 of the North Carolina Rural Assembly. Yesterday, we heard from Create Your State about how we can inspire our communities through some rather unconventional means. And we hope they inspired you through some rather unconventional means as far as a conference keynote goes. We also heard from Mike Hawkins, Mac Hodges, and Jonathan Russell about all the good things that are happening in Transylvania County and in Washington, North Carolina. You packed our breakout sessions yesterday afternoon and contributed to the overall theme of the day, which was collaboration, innovation, and creativity. We can't wait to get on with today, and we think it'll be equally as inspiring, and we can't wait to hear about all the work you're going to do back in your communities in the months and years to come. We did have we had a lot of prizes last night. If you were at the reception and you made your way around to all the various organizations that participated in our resource fair last night and signed up, there's a chance you might have won a prize. So I'm going to tell you who did win those prize drawings. And if you won a prize, you can just go to the registration desk and claim your prize. First one is a 10% cooperative extension reusable bag from Center for Environmental Farming Systems, and Holy Smoke, which is a book on Eastern barbecue from the North Carolina Humanities Council. Joyce Holloway won that. We had a 10-piece Pioneer Woman cookware set. Jerry McCrary won that. The Heritage Farms General Store gift basket, Mavis Hill. Where's Mavis? Wait. Echo Dot with clock from Cloudwise, Cornelius Brooks. AirPods from Cloudwise, our good friend from Siler City, Jack Meadows. 2 Echo Shows from Cloudwise, Jill Rushing and Don Brown. And one more Echo Dot with clock from Cloudwise, Michael Kelly. So congratulations to all of you. Make sure you claim your prize. So we're getting ready to hear from one of the real legends of rural economic development in this country, and we're so excited to have Connie with us. You might not have known there was a rural California, but you're getting ready to learn a lot about it, and you're going to find out that some of the issues are very similar, and can't wait to hear from Connie and our good friend Janet Topowski. Janet was an undersecretary for USDA Rural Development during the Obama administration, and we're delighted to have her with us as well. Here to introduce our keynote speaker, I'm glad to introduce our Rural Center Senior Fellow for Policy and Research, Jason Gray.
Good morning, rural North Carolina. So all of us in this room are part of a national network of leaders and advocates who celebrate, encourage, and improve rural communities. Our morning keynote speaker, Connie Stewart, is the Executive Director of the California Center for Rural Policy, and she is a great example of a rural leader who knows how to get good work done. She has been an environmental and community activist, and for 8 years, a member of the Town Council of Arcata, California, a small town with a population of around 17,000 on the northern coast of California. For 2 of those years, she was a mayor, which automatically nominates her for sainthood. As all of our elected leaders in the room know, it is easy to hold positions, but the day-to-day give and take of managing a small town requires consensus building and compromise, and a commitment to listening to all voices. Governing can sometimes lead to consensus by the least common denominator, but Connie's experience is that innovation can serve community vitality. Connie knows well the complex interplays between rural areas and state government policy. For 6 years, she was on the staff of a California Assemblywoman representing one of the largest rural districts in the continental United States. In 2005, she became the executive director of the newly created California Center for Rural Policy, which is located at Humboldt State University. Connie has lived for over 30 years in one of the most rural regions of the country. The north coast of California is known for its 280 to 300 feet tall redwood trees, and Connie's stature is nearly as tall as an expert and a fierce advocate on the rural issues of broadband expansion and health. In 2017, she was awarded the President's Award by the Rural County Representatives of California, the Association of Rural Local Elected Officials. Think ranchers and farmers, y'all, for her accomplishment in support to rural elected leaders across the state. I've had the great pleasure of knowing Connie since 2003. A first impression of Connie is that she has a laugh that is as big as the Pacific Ocean. But immediately after, you feel the cut to the chase confidence of a woman who knows how to get things done. She personifies the passionate creativity for rural places that we celebrate in this Rural Assembly. It is my great pleasure to introduce to you rural North Carolina's newest friend, Connie Stewart.
Good morning, North Carolina. I'm just glad I didn't say California when I said that there. How are y'all this morning? Good. I want to thank the North Carolina Rural Center and my dear friend Jason Gray for asking me to speak today. It's truly a great honor to be here in front of all of you. And for the past 10 years, I've had the pleasure of running the California Center for Rural Policy. The center conducts research to inform policy, build community, and promote health and well-being of rural people and rural environments. And our office is tucked away at the top corner of an extremely large state, which takes about 18 hours to drive from the top to the bottom. So let's take a quick look at a map you know well. This is rural North Carolina. This is what rural California looks like. So let me tell you a little bit about rural California. 36 out of 58 counties in California are rural, and 28 of those, including my own, are larger than Rhode Island. 4 counties that worked together to create my organization in 2005 are so big that this is what they look like if they were juxtaposed over North Carolina. In those 4 counties are 21 federally recognized tribes, including the largest tribe by population and the smallest tribe by population and the largest reservation by landmass in the state. Many folks who've been born and raised in California have either never been to my area, drove through on the way to somewhere else, or, came up for vacation sometime with their family ago, and I bet that sounds familiar to some of you who live in rural areas as well. California is a state that's known for its urban communities, the Silicon Valley, Los Angeles, San Francisco, San Diego. Those communities tend to suck up all the oxygen, all the economic development, all the natural resources and complain bitterly if we ask for anything back. Now, I don't want to leave you with the impression after Jason's fabulous introduction that I've come here because I come from a rural place that's figured it all out. We have big problems to tackle where I come from. Substance disorder, use disorder is rampant. The poverty is high. And how many of you have seen Murder Mountain on Netflix? Yeah, I actually know some of the people in that show, okay? And one other thing that makes me nervous about speaking in other states is that I'm from what's known infamously as the land of fruits and nuts, right? And sometimes when I get off the stage, people walk over to me and say, well, maybe you can get away with that in California, but we could never do that here. So let me just say right up front, I don't want you to focus so much on the things I'm going to talk about that we've done. I'd instead like to ask you to focus on the way we went about doing them. We think out of the box. We try to stay true to our culture, and we use creativity in our attempts to solve problems. And we use our own homegrown rural data to inform our work. You cannot fix what you have not measured. Here's a little bit about my personal journey. Because I wasn't born in a rural community, I've chosen to spend my life in one. My family originally came from New Jersey and moved to the Silicon Valley in the 70s. And when I graduated from high school, I moved up to Humboldt County, and I've never left. And I was one of the lucky people because most students who decide to go to college in a rural community can't find a job, and so they end up moving back to an urban area. But I found a job the day I graduated, and I began working for an environmental organization. And honestly, back then, it was about 1988. I think I was the only black person in the entire country working to save ancient trees. My mother would joke with me that her daughter worked trying to save pooping frogs. So in 1996, as you heard, I was elected to the city council, and Arcata is a small town similar to Boone, North Carolina. And the town would be about half the size it was if there wasn't a university there. When I first went to Humboldt State University, there were only 63 black people at the school, okay? So I was actually the first elected black woman north of San Francisco, which is 6 hours to the south of us. And then I left. Well, I didn't actually leave. While I was still on the city council, I started working for the state legislature for an assemblywoman. I ran her district office in Humboldt County. And then I made my way to the California Center for Rural Policy. I actually didn't start working there until 2010. The center was created in 2005. So I might have that wrong on my website. I got to check that. So some of the stories I'm going to share with you from my time on the city council and the state legislature are from then, and some of them are more recent. But first off, let me spend some time talking about economic development. And I'm going to tell you, when I was on the city council and even today, rural communities are faced with a gut-wrenching dilemma. Do we approach economic development from the standpoint of what's best for the town coffers, or do we do what's best for the citizens? Because most towns get their income from retail and not building quality housing or business spaces, communities often compete for big box stores or for big businesses. The problem is, big businesses are hard to get. They don't have a lot of loyalty to your community, and if they fail, they often devastate the community on the way out. And often, they want some rules changes or some tax breaks that small businesses in your community wouldn't even dream asking for. So what you're looking at here is the size of businesses in the county where I live. It took a lot of years, but some smart economic development leaders in our community decided to change our focus from caring about big businesses to caring about mainly small homegrown businesses. We're constantly asking ourselves one question: what would it take to get each of our small businesses to be able to hire one more person? And as you can see from the slide, that would produce a whole lot more jobs than focusing on trying to chase one big business that has more than 250 employees. Oh, good. Oh, good. So let me tell you a story about how we do this. I'm going to focus on small agricultural businesses in our community. Our economic development leaders actually stole this idea from North Carolina, and we created Humboldt Made. It's a branding nonprofit that specializes on agricultural businesses. And I'm on the Fairgrounds Board of Directors, and I understand that'll get me some rural street cred in this room here. I'm also a master food preserver. And I'm sure all of you know the mission of Fairgrounds is to promote agriculture and leadership. But in our communities, they're often underutilized spaces. So our fairgrounds years ago decided to put a few commercial kitchens in for a few folks that wanted to start food businesses. Instead of building a big incubator facility, some of those kitchens only cost us about $10,000 or $25,000. Some only have hot plates. They don't even have big fans or anything, so we can rent them out cheap. One such business was started a few years ago by two women that make really good sweet and savory pies. When they started, they couldn't even afford to rent the kitchen by the month. They rented it by the day. They loaded and unloaded all their supplies each time they cooked. And after a while, they decided to do a Kickstarter campaign to get space where they could put the bakery and have a small retail shop. And they teamed up with a new hard cider company that was actually renting the chicken barn from the fairgrounds. And the Kickstarter campaign was so successful within a year of moving out and getting their own rental space, they had 34 employees. This year, they bought the building from their landlord. The fairgrounds also was rented to a cupcake company that moved out a few years ago, and now they have 16 employees. So our fairground is renting to a few local producers now, and we've got about 25 businesses that have kitchens. And what happens is we start you off in a small kitchen, and then as you grow, we move you to the bigger kitchen, move you to the bigger kitchen. And how many of you we call them taco trucks, that, they need to clean up and all of that, and so but they don't need a full kitchen, they just need somewhere to come in and cook, so they can rotate through without having to rent a whole nother space at the fairgrounds. The Humboldt Made group that I was telling you about organizes a buyer's tour that helps brand our businesses, and now during that buyer's tour, the Walmart and Whole Foods come up. And so we have many of our companies that are connected now to those organizations as well. It didn't take much cash to do that, but it did take thinking about economic development differently. Another really important economic development strategy that we're engaged in is called growing our own. We have a lot of success growing our own healthcare and human service employees. And healthcare is about 20% of our economy. And without good quality healthcare jobs without good quality healthcare in your community, every other industry and families suffer. So, Thank you. Recently, the university and the community announced a partnership that's creating a bachelor's level nursing program at Humboldt State University, where I work. And our community college helped, with the help of the same partnership, announced that they're adding a registered nursing program at one of their satellite locations up in Del Norte County, which is right at the top of the state. We also have added programs to help medical assistants get their license certification. As healthcare changes, higher reimbursements are going to be available to hospitals and healthcare systems that have better trained nurses. And research is coming out that shows better trained nurses equals lives saved. These accomplishments wouldn't have happened without data and without community putting pressure on our economic partners. Our organization surveyed doctors that were working in our community for less than 4 years, and we asked them 3 questions. What was their expectation when they came to our community? What is their experience coming into our community? And more importantly, are they planning on staying? Before we asked them directly, we told ourselves doctors left our community because there wasn't good shopping and they would rather live in urban areas. But it turns out, according to them, that wasn't true. As a matter of fact, one doctor told us in the survey, if someone else suggests that doctors leave because there isn't a Nordstrom, I'm just going to puke. What they told us was that they were leaving because there wasn't quality housing and because there was a lot of homelessness in our community. And one of the doctors actually had a baby of a homeless couple die, and that really hurt him to his soul. Doctors were feeling socially isolated in our community, and that their staffs were undertrained, and they weren't quite able to work at the top of their license, so they were going home at night and doing a lot of paperwork that they felt other people should do. In fact, half the doctors that took the survey said they were planning on leaving our community. We, like most rural communities, have a major health care access problem, and it costs upwards of $60,000 to recruit a doctor to come to your community. So you don't want them leaving after a couple of years. We simply couldn't continue to do things the way we were doing them. So we've created a partnership of healthcare leaders, education leaders, and economic development leaders that's not only had success bringing back the nursing program, but we developed health career pathway programs for our region's schools. We expose our students to all sorts of health careers, and we also focus on our community's C students, not just the A students. And why do we do that? Because C students stay in your community. And there are a lot of good paying jobs in healthcare that don't require you to be a doctor or a nurse. An A student is a rural community's greatest export. We also have set up scholarship programs to pay those A students who leave for medical school if they want to come back. And if they come back, they don't have to pay us back. But honestly, very few students have taken advantage of those programs. So although they're good, they're not the solution to the problem. Our hospital also realized that they needed to engage in creating affordable housing. They have used their Medicaid expansion funding not only to build housing, but to convene developers and planners to encourage them to build more housing. And they're helping fund monthly meetings with regulators with the goal of making it easier to get a permit to build. Now, I know you all are working on Medicaid expansion, and when you get there, sooner rather than later, it's gonna make a big difference. The other thing our hospital does, thank you. The other thing our hospital is doing is helping to keep our detox facility operating to help our community with our opioid crisis. Now, they could not do this without Medicaid expansion, so I'm praying for all of you to get Medicaid expansion across the finish line in North Carolina. But before I move from healthcare, I want to tell you a story about an incredible community that came together to stop a rural hospital from closing, because I know you all deal with that too. And in 2004, in Trinity County, which is just to the east of me, they had one county-owned hospital, and it was in big trouble. It was badly in need of repairs. It was only a few months away from bankruptcy, and it was a county hospital, so it risked endangering the entire county for bankruptcy. The hospital included the only skilled nursing facility. The county had a public utilities district that was well run and had a great executive director. And people in the community loved the utility district because it kept the lights on. But the utility district and the county leaders hated each other, and they were in the middle of a lawsuit. Now here's where data comes in again. The county commissioned a study to say, well, what would happen if we closed the county hospital? And the consequences were worse than anyone had ever imagined. The study said over half of the population of people over 60 would immediately leave, and that property values and personal income would decline for everyone by about 18%. But as I mentioned, the county was racking up bills on the verge of bankruptcy, and no county in California had ever gone bankrupt, so that was unimaginable. The region a few years earlier had gone through a very painful transition. The timber industry was in decline, and many of the community members had already left the county. The public utility district had taken a big hit on the declining population from the loss of timber jobs, and they realized they really couldn't afford to lose this many people because of the health center closing. And then I had to go up there and have one of the most difficult conversations I've ever had in any community. I was working for the state legislature, and I had to go in a room with the community leaders and tell them they needed to stop suing each other and work together to save their hospital and avoid county bankruptcy. Because there were discussions at the State House trying to decide how to split the county in thirds and give the land to the surrounding counties. They were literally on the verge of extinction. These were very proud people. Many had family members that had been there for generations. So what ended up happening is the county and the utility district became what I call frenemies. They had to work together to have a solution. So the solution was ending the lawsuit, seeking legislation to allow the utility district to run a hospital. You can imagine what that sounded like when we had to go into the urban communities and say, we'd like our utility district to run a hospital. But we got the legislation passed within a month. The utility district took over, they stabilized the hospital, they fixed the roof, they hired better leadership and better billers, and then they put two ballot measures on. One measure would create a hospital district, and the other measure was to tax property owners to pay for ongoing hospital expenses. Well, this was a county that was extremely proud of the fact that they had never supported a tax measure since 1960, and we needed 2/3 vote of the owners in order for the tax to pass. Well, I'm pleased to tell you it did. And that hospital is still alive and well, and it struggles, but what rural hospital really doesn't? So there's a lot of talk about collective impact and about collaborating, but collaborating with friends doesn't cut it in rural communities. So many times we're only able to solve problems with frenemies working together. And at all my talks, I ask people to think about a frenemy they have. And maybe, when you go home, maybe give them a call. Maybe just go for a walk. Have a heart-to-heart with them. Maybe you'll find something in common. And I bet I can tell you one thing you all have in common. You all love the rural community you come from, and that's a start. So now let's talk about broadband. Our community first started working on bringing fiber because our copper wiring was so bad that businesses in some of our communities couldn't get phone lines. In fact, our region had Native American communities that didn't have power or phone lines, and some of them are just getting power now. In 2009, our region created a plan to build a fiber middle mile backbone that could deliver reliable service to any of 100 communities. The reason we have been focused on building a fiber middle mile is to create a telecommunications infrastructure foundation with unlimited expansion capacity to effectively adapt to any future needs. In creating this plan, we surveyed more than 100 communities, and we asked residents and businesses how much they were willing to pay and how much they wanted broadband. And as you can see from the chart, we took those communities and we graphed them. These are the communities that have the highest need and they want it. And communities that told us they weren't really willing to pay for it, they went lower on the list. We also created a database of every anchor, governmental or private agency, emergency services, schools, libraries, and hospitals. And we realized something that's a problem still today. There are programs for getting broadband to anchors, but there are no programs for getting broadband to businesses and economic development. Maybe you can get service to a business after they come to town, but businesses aren't going to come to your town without broadband. So one of the things that frustrates me the most about the broadband work I do is that there is plenty of unused fiber going through rural communities, but the communities lack providers who will deliver it to the houses and businesses. And it upsets me. And many communities have services that aren't reliable and that can't attract the economic development that that community needs. So here's a picture of me and the former Trinity County manager standing on a fiber pipeline that expands from the state of Washington to the Silicon Valley that doesn't service a single rural community it traverses. National Public Radio came to our town and they did several radio shows about our broadband plight, and they actually took this photo. It's on their website. They contacted the company, who you probably can figure out but will remain nameless, in the hopes that one day maybe they'll sponsor, but I doubt it. But we contacted that company and they asked them why they weren't servicing rural communities with this pipe. And as part of that show, the company said, well, it was impossible to use that pipe to service anybody. Well, you probably guessed what happened. We are working with providers to build another pipeline through that community, and we've raised $47 million in grant funding to do it, and we're out raising the private matching funding we need to finish the project that will ultimately provide better service to about 25,000 homes. But the second we got that $47 million grant, miraculously, the telecom company figured out how to open that pipeline. They immediately began working with a competitor who is now suing the state to compel them to take back our $47 million grant to stop us from building. Now, miraculously, they were only able to open the pipe in that one rural community and not any of the other rural communities along that pipeline. There's a coalition of folks working nationally on creating broadband principles, and I'm hoping the North Carolina Rural Center will join our group. We truly need better broadband policy in this country. The digital divide is already too big, and it's getting bigger every day for rural communities. You notice one of the first ones right up there, funding should be simple and allocated directly to infrastructure needs, not directly to last mile carriers. Let me just say also that although wireless is what some communities can get today, California is experiencing catastrophic fires and power outages due to high wind that are affecting millions of residents. Wireless towers burn up, and they were affected also by the power outages in our recent fires. And I bet you all have stories about hurricanes and broadband too. Wireless is not the solution for rural communities who need a long-term strategy and need to consider climate adaptation. In rural regions, we deal with complicated issues, and there's nothing that exists in silos. People in institutions that understand community needs and how to get things done, like many of you I've met in this room and had the honor to meet at this conference, know that success depends on connecting to frenemies, to resources to partnerships wherever they exist. Some would call this being a social entrepreneur. One of the things we've done as part of my rural America is cultivate social and civic entrepreneurship, because entrepreneurship is too important to leave to chance. It needs to be part of a community's DNA, both for individuals and for institutions. Every nonprofit in your community matters, as does every small business. This is our North Star. This is our truth. But we are not alone in this journey. And my dear friend Janet Topolsky and her colleagues at Aspen Institute, who are leading a workshop in a few minutes, have just released a report about rural development hubs. And they tell an important national story. And, you know, the Rural Center is one of these hubs. They have a transformative role in their rural communities, whether at the community level, or at the regional level, or at the state. These are institutions that are embedded in rural places, and most importantly, they're trusted institutions. These organizations have long enduring relationships, know how to connect, how to bridge, and how to translate. These are partners for the long haul. And these are not service providers, they're system changers. This is a learned skill. It takes practice. But if you love rural places and you're committed and patient and willing to press on, to grow, to learn, we can be part of something very proud and beautiful, and that's the revitalization of rural America. It's going to take creativity. It's going to take some risk. No risk, no reward. But don't you think the rural place you come from, that you love, is worth that? Thank you so much for listening to me today, and thank you to the Rural Center for giving me this opportunity. And thank you all for living and loving rural America. Thank you. Thank you. Thank you. Thank you. Did I leave time for questions, or are we done? We got question time. Anybody have a question? Comment? Nobody? You know, I want to say, because I heard the ooh and ah at the $47 million grant, we didn't start off doing that. We did something that that everyone can do. We looked, you know how they have these big national conferences? We looked at the agenda for a big national conference, and you know how communities like raise money to have one person go off to a conference, and then that person comes back and goes, oh, it's such a great conference, yeah, and then they go back to their lives and nothing's ever learned. We looked at the National Broadband Conference agenda, and instead of sending one person, we said, who would we like to hear from on this agenda? And we called them, said, would you come to our community? We got trees, we'll take you, you can hug a redwood, you know. And we had $5,000, that's all we had. And all of them had expense accounts. None of them asked for money to come. They all came, and we put them on a stage, and they all talked to us, and we fed them well. We actually used part of that $5,000 to just feed them, and we made our politicians come to the dinner. They didn't, at the time, they didn't care about broadband, but we could get them to come and eat food, you know. And so those people went and said, wow, there's this community up there that, you know, we just went to, we had a great time there, and so they told their friends. And then the next year we did that. And then the next year we did that. And now, like, every rural provider will tell you about my peanut chicken. Like, have you had Connie's peanut chicken? Have you had Connie's ribs? Wait, I didn't get Connie's ribs. I only got the peanut chicken. Well, you need to come back to her community. So that's how we built our reputation in broadband, was we made them come to us. So whatever issue you're working on, think about next time not sending one representative, but asking those people to come to you. That is one tip I can give you, and that's how you start. building the kind of gravitas you need to build for your community. Yeah, question, please.
I'm coming to you.
Here comes the mic.
Thank you so much for your comments. Very inspiring. Thank you so much. Maggie Sauer, Office of Rural Health.
Yes.
We had a chance to chat
We
last
did.
night. So when you were talking about the hospital, saving the hospitals and didn't close down, I think to your point, there is this missed opportunity to address hospital maybe redesign to meet the needs of the community and engaging the entire community in a discussion about that. We've had a few situations in North Carolina where the hospital is at the edge of closure, and then that's when they engage the community.
That's right, it's too late.
So can you talk a little bit about that process? You know, we were sitting here chatting about, you know, it's got to be everybody who's in this room having a discussion, and if you're not having a discussion right now, you know, I think it has to start it, because a hospital, there's none of our critical access hospitals that are not in a place of danger.
Oh, they're not going to let me go back to that slide.
So anyway, if you could comment a little bit about that, I'd be really grateful.
Well, you know, that partnership got created because we realized not only that, but even healthcare leaders in our community were not talking to each other. And I've talked about many things, and I can't take credit for a lot of them, but I can take credit for creating that table. And when I did, those people were afraid to come out and talk in public. And I had to go hold the hand of each one of them because they were just mortified they were going to get beat up. And so I would promise them I was creating a safe space for them. And that's what we had to do. And it was like, okay, if you don't want to tell the whole community, tell me. And then didn't it feel good to unburden yourself? Now let's talk about it with the rest of the community, you know. But I mean, literally, we had to build that trust because the hospital person had never met the FQHC person, had never met the director of Health and Human Services until I made them come in the room together. And we actually went to Grand Junction, Colorado, which is a community that has similar issues to us, but a lot less poverty. And one of the things that Grand Junction had was a table for healthcare providers to get together. And what happened is if there was a dispute between them, this dispute wasn't us versus them anymore. It was at the table. It was the table's responsibility to solve the thing. One more question is what I'm getting. But you know, the first thing they said is, you got to solve the workforce problem. So I said, if you want us to work on workforce, you got to give me your HR directors twice a month. Twice a month, I want to meet with your HR directors. And my icebreaker question is, how many of this employee is working at the top of their license, and what can we do? Because that's the biggest problem for a lot of these places, is how many people are doing administrative work instead of working at the top of their license. So, you know, we can't necessarily keep improving the number of employees, but we can get them to perform. We can get them some skills so they can perform better. So, but if your hospitals aren't talking, if you are leaders in your community and you're not talking to your major providers because they haven't come to you and told you there's a crisis, when they tell you it's a crisis, it's too late. So go, that's maybe not frenemies, but go talk to them. Those are people you want to take a walk with. Yeah. And if they're not taking a walk with you, then you got something to worry about. So, because that's what happens is people are so afraid they clam up. And really what you need to do is give them a space to unburden themselves. Anybody else? Then I'm going to thank you. Thank you so much. Thank you for all you do. Thank you.